of the COVID-19 pandemic. All right, so let's talk about the factors, risk factors, or we call determinants of anxiety and depression. The first one is trauma. Whatever it is, any form of abuse, be it physical, be it sexual, be it emotional, can affect, okay, the person experiencing it and could lead to anxiety and depression later in life. All right, so if you experience some trauma in your life, and you might be prone to anxiety and depression. I mean, it's not funny, but I'm just really happy right now that I have this opportunity to share with you my knowledge um, about this topic. Then we also have stress. Okay, we experience stress every day, but this stress, it's a stress buildup that could lead to anxiety or depression. I'm gonna give myself as an example. Last week, um, I received a bad news from my sister that my aunt who lived with us for a long time had passed away. She had a massive stroke, and they brought her to the hospital, comatose already, and it really devastated me, and I was um, so sad because she's like my second mom. So I called uh, my workplace because I cannot function. I cannot function really. So I called my workplace if I could file a bereavement leave. You know, the we are already stressed at work. All right. So it's that build up. You know, if I have not filed a bereavement leave, I don't know. I may have, I may experience anxiety already because a death in the family is already stressful. All right, so you couple it with the work, the stress at work, then you'll never know. Um, it might be just a little push, and you will have anxiety disorder or depression already. All right. Moving on, the next factor is personality. There are actually, according to research study, there are actually two personality traits that could trigger anxiety disorder and depression. The first one is neuroticism, or very emotionally sensitive, and the other one is introversion. Okay, a neurotic person would see the world as distressing, traumatic, or upsetting or unsafe. All right. While an introvert person uh, likes or enjoys being alone and would have a panic attack when thrown into a large crowd or um, while in public. All right. Um, this people thinks that their energy is being drained when while in public. Okay, just FYI though, do not interchange or get confused with um, shyness and being shy or and being an introvert. Okay, it's two different things. Okay, They are not the same. Being shy does not mean you are an introvert. All right. So why do you think these two personal personality traits are considered a fact or factors in that could trigger anxiety disorder or depression? Why do you think that is? According to research study, um, they found out that neurotic people and introvert persons or people are the ones most likely to experience negative thoughts. All right. And we always say to think positive. We always say that because it will affect our life as well. Negative thoughts um, is not healthy mentally. All right. So moving on, let's go to genes. Okay, another factor for that would or determinant that could trigger anxiety and depression is the genes. Anxiety and depression runs in the blood. Okay, so if you have family history of depression or anxieties, better watch out because you are prone. All right, and then lastly, it's drugs or alcohol, or much worse if you combine both drugs and alcohol. So they are a precursor for anxiety disorder and depression. Measurements. So what are the measures to identify anxiety and depression? In our hospital, we use this form. We call it HADS, or Hospital Anxiety and Depression Scale. This is what our psychiatrists officially use. This is a questionnaire, and the psychiatrists ask series of questions to their patients to evaluate them for anxiety or depression. Um, they could score between 0 to 21. So after they finish answering the questions, the psychiatrist would total the score. So 0 to 7 is normal, 8 to 10 is borderline abnormal, and 11 to 21 is abnormal. All right. And this is what I actually use when I assess when I do my nursing assessments to my patients and evaluate them for not necessarily anxiety and depression, but to evaluate their behavior that time or that moment. This is called a phase depression rating scale. We evaluate the patient um, on their mood and their sadness. Okay, so they would rate it from between 0 to 10, and 10 being the worst. When 0 is actually no sad, and 10 is freaking sad. I use this because it's very catchy, and the patients love them actually. And we also use this one. This one is for anxiety. It's called face anxiety rating scale. And the patient would also rate it from 0 to 10, 10 being the worst. So when they rate it uh, 0, it means it's looking good. Don't change a thing. And when they rate it their anxiety as 10, that means you've enraged the beast, I will hurt you now. So that's when your patient rate his anxiety, his or her anxiety to, at 10, you better run, because before you get hurt. That's the time when you call the code gray. All right. Signs and symptoms. The signs and symptoms of anxiety and depression can actually occur at the same time. All right. So they figure to just to keep it simple, psychiatrist would treat the patient with anxiety and depression at the same time. The causes of each condition are different, but the treatment, the management, and the and symptoms, signs and symptoms may be the same. All right, I got this signs and symptoms from Banner Health and their website. Um, these are actually warning signs for anxiety and depressions. Signs and symptoms such as problem with sleep, irritability, difficulty concentrating, loss of appetite, poor hygiene, and of course, feeling sad for days. All right. And management or treatment. As I've mentioned earlier, the treatment for both anxiety and depression are the same because they overlapped anyway. So psychiatrists might as well deal with the two conditions as one. All right, in our hospital, we use STP and SBP as treatment plans. STP stands for Special Treatment Plan, and they are tailored for each patient's diagnosis. So there is an STP for anxiety that is specific for anxiety and depression. And also we have SBP, which stands for Special Behavioral Plan. This one is tailored for each patient's behavior. Okay, so if they manifest a behavior as angry or as sad, there is a special behavioral plan for that. And of course, there are other treatment for anxiety and depression, such as psychotherapy. Okay, this is the treatment used by psychologists. You know, they just come up with a treatment plan for patients depending on their diagnosis. So there is a psychotherapy that is specific for anxiety and depression. And the medications are mostly are always prescribed by the psychiatrist. All right, and there are different groups of antidepressants. These antidepressant drugs um, can be treated or can be used for both anxiety and depression. The first one is SSIR. All right. Let me see if I could remember what does it stands for. So SSIR stands for selective serotonin reuptake inhibitor. Okay, example of this are Lexapro, Prozac, and Zoloft. All right, then another group of antidepressant is called SNRI, which stands for serotonin norepinephrine reuptake inhibitor. Examples of this are Cymbalta and Effexor. All right, and then for nurses, we use, aside from therapeutic communication techniques, of course, we use the so-called self-help. All right, for me, when as much as possible, I try to encourage my patient to be as independent as possible when they are still in our hospital. In that way, when they go back home, when they get discharged and go back home, or to their go back to their family, they will be able to use their coping skills without any help from professionals. Okay, and that is called self-help. But of course, there are other suggestions by Mayo Clinic, such as getting organized. Um, this one is pretty obvious. This is not only um, this is not only used for patients in the a psychiatric hospital. We could actually use this in our everyday lives. Um, Getting organized, organizing or tidying our surroundings, like at home. You know, we try to declutter your physical environment will declutter your mind, and you will notice a lot of difference it can do to your happiness and productivity. And I'm not sure if you heard about that Japanese declutter lady, Marie Kondo. Her decluttering philosophy has a lot of practical use, you know. And as I've said, decluttering your physical environment will declutter your mind as well. Even simple things such as like email inbox. Just organizing your email inbox would will really make a lot of difference. All right, and of course, making new goals. um as for me, during lockdown, as I've said, I tried to uh use that opportunity for me to do the things that I wanted to do, and that can make me happy, and that is my passion for dancing. So I actually set goals for that, and which I tried to accomplish, and one goal lead to another, and yeah, here I am. I'm a certified Zumba instructor. All right. Um, where I think this is the third to the last slide. So let's talk about global health context of anxiety and depression. There was a study last year in August 2020 about the prevalence of anxiety and depression in the general population of the world. Okay, and this are the results of this study. The first one is in gender. They found out that there is an increase in anxiety and depression in women more than men. All right. There is an increased anxiety and depression in women more than men. I'm just I'm just a messenger here. Don't get mad at me. I'm this is based on research, so I'm just I'm just telling you the truth. But kidding aside, I think it has to do something to do with hormones. It it's the result of the study showed that it's mostly hormonal in nature. All right. How about age? How about age? What do you think they found out about age? We all know that older adults have increased anxiety and depression, right? We all know that because of their um, susceptibility to a COVID-19 illness. But on this study, they found out, and I was also surprised with this one, they found out that it's the 21 to 40 years old, which is the young adulthood. Okay, this work this age groups are the ones who actually have or have experienced increased anxiety and depression uh, at the start of the COVID-19 pandemic. All right. Why do you think that is? Why do you think that is? Remember, 21 to 40 age groups are the key active workforce. Okay. So they are concerned about the future consequences as well as, um, financial constraint. Now, how about education? What do you think they found out about education? There is a related research study done in China in September 2020. That was last year, September last year. This study showed that higher level of education is associated with increased anxiety and depression. Okay, higher level of education. It could be me, it could be you. I mean, like we belong on this level, higher level of education. So, why do you think that is? Why do you think that is? They found out in this study that people with higher level of education are self-aware of their own health. They are self-aware of their own health, especially us, like one with medical knowledge. So we kind of like, get somatic sometimes. Oh, I feel I'm having some runny nose, or I'm having a sore throat. Am I getting COVID-19 or whatever? And then we'll look up on the internet, and we Google them and stuff like that. So yeah, that's it. And how about medical history? This is a given. This is a given. Those, as I mentioned earlier, those that has a chronic disease, such as hypertension, heart disease, diabetes, or even kidney disease, are the ones that has increased anxiety and depression during COVID-19 pandemic. So let's focus on um, the research study done in the Philippines regarding the psychological impact of COVID-19. Okay, this is in the Philippines. By the way, Department of Health in the Philippines said that mental disorder or mental illness is the third most common disability in the Philippines. The third most common disability in the Philippines. All right, so according to this research study, this was actually done at the start of the pandemic. That was in April 2020, they found out that 6 million Filipinos, I'm not kidding, 6 million Filipinos have anxiety and depression. 6 million Filipinos. And it makes us the third highest country in the entire Western Pacific region. All right, 6 million Filipinos. Why do you think that is? Why do you think this is? One barrier, according to this research, they said that it is because our rate, help seeking rate is low. It's even lower than the general population in the whole United States. Even lower on the ones compared to our neighboring Asian countries, our help seeking rate. All right. And I think it has something to do with our attitude as well. We will be discussing that on our next slide. This will be our last slide, and this is the nursing implication of COVID-19 on our mental health. All right. As you all know, and I am a psychiatric nurse. You might be tired. You might be already tired hearing this one, but I want I want to make a point. I want to prove a point. As a psychiatric nurse, I am a proponent of mental health. Mental health is my advocacy. If those Binibining Filipinas girls have advocacy when they join the beauty pageant, I also have my own advocacy. And I thank you. No, I'm kidding. So, my advocacy is mental health, and I already lost my train of thought. I'm sorry, but you know what? You gotta help me. You gotta help me be an advocate of mental health and mental disorder. All right, we need to have a hashtag. Okay, our hashtag should be "It's okay not to be okay." So hashtag "It's okay not to be okay." Especially for us Filipinos, we always want to mask our true feelings. Sometimes we feel down, sometimes we are in a bad mood, or sometimes we are a little under the weather. But we try to cover it, and we could still manage to smile because we don't want other people to feel that we are weak. All right, but masking our feelings and not expressing our true feelings is actually not healthy. So we need to express ourselves in a manner that is acceptable. Okay, in a manner that is acceptable, as socially acceptable. And that way, uh, if we hide it, we will never gonna know. We will never gonna fix the problem. All right, so we need to just be true to ourselves, in that way, we could find solutions to our problems. All right, and so we should be united. We should be an advocate of mental disorder, and we need to stop that social stigma, that fear of negative perception, that fear of negative, that fear of social exclusion, social rejection. Okay, that mental disorder is something that could ruin or destroy our family reputation. We need to stop that. And I think it has something to do with our culture too. Um, our belief system, it's already embedded in our belief system. Um, that supernatural or a superstitious causes, such as like um mental disorder is caused by witchcraft or the aswang, or mental disorder is caused by sorcery or pangkukulam, all right? Or you will say, or kinulam. All right, and people in the rural areas also tend to go to a folk or faith healers instead of seeking professional help. All right, and we also have um, practical reasons, practical reasons why um, there is actually we cannot eradicate or we cannot reduce the mental disorder in the Philippines, and we never discuss about it anyway in public, right? So it could also be a practical reason, such as financial constraints. People in the barrio does not have enough money to seek medical or mental health services. Okay, and it also has to do something to do with access to mental services. I know that there's one in Putotan, a government owned mental institution. In Bacolod, because I'm originally from Bacolod, we have a private owned mental institution in Paglaom, but for those that are less that has less in life, are hesitant to go to a private mental um, institution. All right, but the good news though, we have vaccines now. We have COVID vaccines, and I am so happy because of that. I am fully vaccinated, and whatever it is, whatever COVID vaccine available in the market, just use it. Get vaccinated. We always wanted. I personally would want to encourage everyone to get a vaccine because that's the only way we could go back to our normal lives. And I actually attended this education seminar just last well, it's actually 2 weeks ago. It was offered by our um the local nursing organization that I am part with. It's called FNUGS. So we called it education seminar because it was um held via Zoom, and we had invited a Filipino immunologist from Baylor Medical University. And we specifically asked her about the Beijing based um, Sinovac vaccine. She said it's okay. It's okay. It is an inactivated or dead virus, and it's okay. It's safe and it's effective. So don't hesitate to be vaccinated because we already had weighed the benefits and risk of the COVID-19 vaccines, and the benefits outweigh the risk. All right. And this is the only way we could achieve herd immunity. You know, when 70% of the population is vaccinated, then we will achieve a herd immunity. What does that mean? It means that when we achieve herd immunity, we are already immune to the virus. All right. So, in that way, if we are, most of us are vaccinated, then we will also maybe reduce the incidence of anxiety disorder and depression. All right. So I think that ends my report. I'm just showing you my references, and there questions. Well, this is a recorded video. So if you have questions, please email me your questions at Elaineski, Elaine ZKY406 at yahoo.com. Or you can message me on Facebook. My profile name is Al Cruz. Um, um, Invite me as a friend, okay, in Facebook, because I need more likes on my dance videos. No, I'm kidding. So I think that's it. Before we part ways, my last message is to to enjoy and have fun. Life is short not to enjoy it. Thank you very much. I'll see you. Definitely gonna see you guys. All right. Thank you.